We are the Gujarat Technological University. Since its inception over a decade ago, GTU has been empowering young and curating minds to realize their true potential. Over 4 lakh inspired students are enrolled with one of the premier academic universities in India. With more than 450 affiliated colleges in its fold operating across 5 zones of the state, GTU, the International Innovative University, your place to move forward.
नमस्कार डियर स्टूडेंट। सारी दुनिया कहती है कि हार मान लो, लेकिन दिल धीरे से कहता है एक बार और कोशिश कर, तू जरूर कर सकता है। हमने हमारे जीवन में कई बार देखा हुआ है, हम कुछ काम करते हैं, उसमें फेल हो जाते हैं और कोई और हमने कहता है बस अभी तो कुछ भी मत कर, मगर दिल में से धीरे से आवाज आती है एक बार कोशिश कर, तू जरूर कामयाब होगा। उसी के साथ आज हम एक नए टॉपिक के बारे में चर्चा करने जा रहे हैं, बेसिक प्रिंसिपल ऑफ कीमोथेरापी और बेसिक प्रिंसिपल ऑफ एंटी माइक्रोबियल ड्रग। फर्स्ट वी डिस्कस अबाउट द कीमोथेरापी. The chemotherapy is the combination of two words. First one is the chemo and second one is the therapy. Chemotherapy, chemo is called the chemical or drug. Therapy is nothing but treatment. Chemotherapy is called the treatment of disease. This type of the therapy we can say this is the chemotherapy. Chemotherapy often called a chemo. It used of the drugs or chemical to treatment of the disease. It's called the chemotherapy. The use of the chemicals to destroy or inhibit the harmful parasites without disturbing the host tissue. This is the most important thing. Host tissue. The chemicals to destroy or inhibit the harmful parasite without disturbing the host. That means where the infection is occurring, those particular area cannot be affected. This is the main role of chemotherapy. The word derived by the Paul and Reach at the beginning of the 20th century. The first word those are originated or tell one word. This is the chemotherapy. It is by Paul and Reach, this scientist. So he is also known as the father of modern chemotherapy. The new definition of the chemotherapy, the use of the synthetic chemical to destroy ineffective agent, that means bacteria, virus, fungus and parasites. This type of the chemical agent we can say this is the chemotherapy. Also applied to inhibit growth of the malignant or cancerous cells within the body. This also we can say chemotherapy agent. Other word we are using surrounding to us. The chemo that nothing but or we are thinking about the treatment is going on related to the cancers. So sometimes inhibit the growth of malignant and cancerous cell within the body. It's also we can say this is the chemotherapy. Here some example of the where the chemotherapy that become working. Some bacterial infections. Here you can see this is the bacterial infection. Due to this we have to finding the wound. Here another bacterial infection that near to lips, and this bacterial infection we have to find on the cheeks, and this bacterial infection happening onto our legs. This is some examples. In these disease we use the chemotherapy. Some fungals. Here you can or neck area. This is our skin area between fingers, and here you can see this is the on our leg. So just this is the this is the some of the fungus we have to find out, and in these fungus we are using the antifungal, and antifungal is the main parts from the chemotherapy. Malaria. Malaria is mainly occurring by the mosquito, and due to these, the patient is suffering with malaria, and during those times we are getting the treatment. Those treatment we can say this is a chemotherapy. Some cancer agent, that is skin cancer as well, this is the tongue cancer, and these cancers are also treated by the one chemical agent. Those chemical agent we can say this is the chemotherapy. AIDS, acquired immunodeficiency syndromes. It's a virus disease mainly occurred by the HIV, human immunodeficiency virus. And in these virus treatment, we are using the antiviral drug. And antiviral drug is the main origin from the chemotherapy. So here we discuss about the various bacterial infection, viral infection, fungal and protozoal infections. Main treatment is a chemotherapy. So this chemotherapy including mainly two words or two things. First one is the antibiotics and second thing with chemotherapeutic agent. First we discuss about the antibiotics. So antibiotic is the agent produced by the some microbes having the properties to kill or inhibit the growth of organism. This type of the agent we can say this is the antibiotics. Today, the many antibiotics derived from the synthetic forms. In earlier, we are known the most of antibiotic those are derived from the natural sources like the bacteria, fungus, virus, and protozoals in protozoa. But today's the antibiotic also derived from the synthetic form, that means chemically form. Some example from this antibiotic is the penicillins, streptomycins, and tildes we would find azithromycin. This is the examples of the antibiotics. The antibiotics may have the narrow spectrum antibiotic as well as the broad spectrum antibiotic. First, narrow spectrum antibiotic, that means these narrow, that means these antibiotic only effective against the gram positive or gram negative bacteria or microorganism. This type of the agent antibiotic we can say narrow spectrum antibiotic. Narrow, that means we are using what? Narrow minded surrounding. Narrow, that means those having some a limited area. So here this drug only effect against gram negative or gram positive. Broad spectrum, that means these agent against both gram positive as well as the gram negative bacteria. This is broad spectrum type of antibiotic. We are using wording to surround routine life. Broad minded person is there. Those having the big ideas, big thinking power. That means more than one gram positive as well as the gram negative microorganism. Next, what is the chemotherapeutic agent? Chemotherapeutic agent is also destroy or prevent the growth of microbes but may not derived from the living organism. So this thing here you should remembering that these are the agent destroy or prevent the growth of microbes but not derived from the living organism. This agent can't derive from living, but antibiotic we derived from microorganism as well as synthetic form both. All chemotherapeutic agent are antibiotics. All chemotherapeutic agent because of an antibiotic that may be from the synthetically as well as the naturally. So chemotherapeutic agent we get from the synthetically from. So whole chemotherapeutic agent we can say this is the antibiotics. But all antibiotic are not a chemotherapeutic agent because of the all antibiotic are derived from the natural as the synthetic, but chemotherapeutic has only synthetically formed. So we can't say the whole antibiotic is not all chemotherapeutic agent. Some example is there sulfonamides, isoniazides, and metronidazole. These are all derived from chemical sources, that means synthetically sources. The word derived by the Paul and Richera, chemotherapy, father of modern chemotherapy. The evolutionary period of the chemotherapy can be divided into four periods. Means history behind the chemotherapy. First, pre-Andrich era, that means before 1891. Second thing, the Paul Andrich era. During the Paul Andrich era, what things are happening? 1891 to 1935. Modern era of chemotherapy and golden era of antibiotics. In the first thing, pre-Andrich era, before 1891. In this, the compound was cinchona bark used for the malaria and mercury in the syphilis. Means before 1891, unreached era is there. उसके पहले की बात है जहां पे अनरिच era नहीं था. During those time, the cinchona bark are used in the treatment of malaria. Earlier level, there is no regarding information about the chemotherapy. And mercury is also in the treatment of syphilis, the skin infections. So this is the earlier going. We are knowing our history, having knowing that this agent are used for particular infectious material. In Paul Ehrlich era, 1891 to 1935, done number of observation. Paul Ehrlich era done so many experiment on Spirochaeteals bacterium and the Treponema pallidum, subspecies of pallidums. Syphilis are cured by the organic arsenic. He decided syphilis is cured by organic arsenic. Number of experiment on animal which infected with the microbes causing the syphilis and treat with various chemicals with different doses. The idea was kill to parasites without harm and damage to host. They done so many experiments and they identify the kill the parasite but without harming to host cells. And he synthesized about 606 compound in which salvarsan only effective, which salvarsan is only effective, but other arsenic were not effective. So just that here in these Paul Heinrich era, during those time, he done so many experiment out of these. He decided the salvarsan is only effective against the syphilis. So this is the thing happening into Paul Heinrich era. He also gives some other informations regarding the chemotherapeutic index, means margin of safety for some chemotherapeutic drugs. Margin of safety, that means we are says that this drug are used to those particular dose. What is dose? If we go to more than that dose, we find some toxic effect. So those ratio we can say margin of safety. Safety is there. Suppose I have one good example is there. If we run or just drive the car more than 100 kilometers per hours, that may chance of complex. So this is a margin of safety. Safety. We can't go more. Same as the, so just we use the more than concentration drug that may be produce side effect. So this is called a margin of safety. This thing is done by Paul Heinrich. He also discovered the drug with parasitotropic actions and no organotropic action. He also discovered that this drug that only inhibit or kill the parasites, not effect onto the organs. An agent only combined with parasite does not interfere with the host. Modern era of chemotherapy was started when the dogma the scientist comes introduced the sulfonamides 1932, successfully antibacterial agent because were effective against the number of pathogenic microbes. Sulfapyridine was the first sulfonamide to marketed in 1930. It is the first drugs. Various antibiotics were discovered like the penicillin by Alexander Fleming 1928, streptomycin, Waxman 1944. What about Alexander Fleming? So Alex, working on the culture of the staphylococcus in his laboratory, found the mold was screening substance that was killing the bacteria. So this thing find out by Alexander Fleming. Just here you can see the Alexander showing some observation onto his petri dish in his laboratory. So here you can this petri dish. This is the penicillin colony is there. Here you can see this penicillin colony, that zone of inhibition, and here the growth of bacteria is there. In between there is no growth, that indicated this is the fungus that produced the zone of inhibition. This area we can say area of inhibition of bacterial growth. So this is done by the Alexander Fleming. Chemotherapeutic agent as the bacteriostatic and the bactericidal. The bacteriostatics, that means that these are agents inhibit the growth of bacteria. Sulfonamides, nitrofurans and erythromycin inhibit the growth, nothing to kill. This type of the agent we can say bacteriostatic, bactericidal, kill the bacteria, that kill the bacteria. Example is penicillin, streptomycin, polymyxin B is the example of bactericidal drugs. Thank you very much for watching PharmaJosh YouTube channel. Please like our channel, share our channel, सब्सक्राइब्स एंड ये आपको अच्छा लगा है तो कमेंट भी कीजिए. थैंक यू वेरी मच.